Appreciate this. So my talk today is really going to be stepping back and kind of doing a summary and overview of many of the things that we touched on this morning, and kind of bringing us back to the first topic this morning, which was sort of an overview of some of the issues related to the regulation of direct-to-consumer genetic testing. So I think one of the important points that was brought up in this morning's session that really needs to be highlighted is that we need to clarify when we're talking about regulation about what are we regulating. And different aspects of direct-to-consumer genetic testing may prompt different regulatory responses. So we've talked a lot about personalized genomic testing, these companies like 23andMe and Avigenics and DecodeMe, and that's what I'm going to focus on today. But there's also a lot of companies that offer tests direct to the consumer that are based on single gene tests. There's also a lot of companies that do direct-to-consumer advertising and don't do sales of their tests directly to the consumer. And so each of these areas might have integrated regulatory responses, but also might require some unique adjustments in the regulatory response. Even within personal genome testing, I would argue that there might be a need for some sort of stratified approach, which has been suggested several times this morning. And that's really because most personal genome tests that are offered over the internet have multiple test purposes. We talked a little bit about the fact that many of these companies engage in ancestry tracing, and a lot of people use these services primarily to get information on their ancestry. They also provide information about a ton of recreational traits, and we've had lists shown of the many recreational traits that you can be tested for. What kind of earwax type might you have? Do you have a propensity for bitter taste? Things that you might be interested in, but we could probably all agree on would not be necessarily medical information. And then they also provide, many of the companies provide real medical information to individuals, so susceptibility to certain disease risks and drug responses. But even within those medical tests that they're providing, I think we've heard that there are varying levels of risk associated with the different types of medical information that they're giving you. So I'm going to kind of throughout the talk give you points that I think solutions, potential solutions, points for discussion that I think have come up this morning, but also that we should focus on. So the first point would be the fact that this idea of having a risk-stratified approach to regulation may be necessary in this context. This was suggested and recommended by the Secretary's Advisory Committee on Genetics, Health, and Society in the United States. And I would say one of the biggest obstacles here is that I have not yet heard a very well-articulated plan for how we're going to do this risk stratification and what are going to be the criteria for determining what level of regulation different tests get depending on what risks they present and what types of tests they are. So as we talk about regulation, I think I want to go back to one of the first points that was made this morning.